Okay, so now we will going to discuss about how staphylococcal aureus enters in the body and how they cause infection and what type of infection they cause. So we will going to divide this entire topic into two videos. In one videos we will going to only discuss on how staphylococcal aureus enter inside our body and what type of infection they cause, and in another video I have kept for you a new thing, that is the biofilm formation of the Staphylococcus aureus. That is the important topic of Staphylococcal aureus, so I have made a separate video on this. Okay, so let's start today's video where we will going to discuss about how they enter inside our body and what type of infection they cause. So first important thing is Staphylococcal aureus are extremely common. Okay, and they are the normal flora of the skin, and about 1/4 of the population is colonized by Staphylococcal aureus. Staphylococcal aureus especially colonizes the nostrils, armpits and goins. Okay, so now let me tell you that Staphylococcal aureus is the normal flora of the skin, and we all know that skin is a very complex ecosystem, consists of different type of microorganisms, right? And Staphylococcal aureus is one of them. Okay, so now if the condition of the skin promotes staphylococcal growth, so under such circumstances Staphylococcal aureus can dominate the skin ecosystem. So what type of condition promotes staphylococcal growth? So mainly the pH, humidity and sweat level, and the presence of other bacteria, some specific bacteria facilitates the colonization of the Staphylococcal aureus. Okay, so that is the idea. That means Staphylococcal aureus is the normal flora of the skin. Okay, but under certain condition, that conditions are promoted by pH, humidity, sweat level and presence of some specific bacteria, Staphylococcal aureus colonized the the skin ecosystem. Okay, and now when there is a too much amount of Staphylococcal aureus around on the skin, they try to penetrate through tiny micro fissures. Okay, tiny micro fissures. So these tiny micro fissures is present in the skin because of eczema or maybe due to shaving. Okay, and there can be, and this is the normal condition and that is not a very problem to us. But when there is a larger break present, for example let's say due to some surgery, okay, under such circumstances this larger break allows large amount of the Staphylococcal aureus to enter inside the skin. Okay, and as large amount of Staphylococcal aureus entering through the skin, so they will cause infection. There is no doubt about it, because there is the amount of the microorganism is high here, so there can be a chance that Staphylococcal aureus can cause infection under such circumstances, right? So in short, when Staphylococcal aureus amount is low and the entire skin is intact, you can say that Staphylococcal aureus will only colonize if the environment supports its colonization. Okay, and what are the factors of environment that supports colonization? They are pH, humidity and sweat level and presence of other specific bacteria. Okay, and if the amount of Staphylococcal aureus is higher and there is a presence of larger breaks, it will surely facilitate infection. Okay, so Staphylococcal aureus now invades the skin and enters. So first it will cause a localized skin infection or pimple. Okay, and this pimple will evolve into furuncle or boil. Okay, and then bunch of furuncle will cluster together to form carbuncle. I hope you can understand, right, that first after invasion of the Staphylococcal aureus, it will cause a localized skin infection or pimple. Okay, and then this pimple will evolve into furuncle or boil, and then bunch of furuncle clustered together to form carbuncle. Okay, and you know what, there can also be some diffuse skin infection, okay, like superficial impetigo, that is infection of the epidermis. So let me tell you that skin has three different layer. One is epidermis, which is the outer one, then dermis, and another one is hypodermis. Okay, so superficial impetigo is the infection of the epidermis. Okay, and there can be also deeper reaching cellulitis, which is an infection of the dermis. Okay, and that can spread through larger surfaces rapidly. So there are some initial infections, right? So what are they? Let's try to repeat again that after invasion of the Staphylococcal aureus will first cause some localized skin infection or pimples. Okay, now this pimple will evolve into boil or furuncle. Okay, now those furuncle or boil cluster together to form carbuncle. Okay, and there can also be some diffuse skin infection such as superficial impetigo, okay, that is infection of the skin, or deeper reaching cellulitis, okay, that spread through larger surfaces rapidly. So that is the first level of infection that is caused by Staphylococcal aureus, and when it reaches deeper from that part, it will causes subcutaneous abscess, okay, which is a collection of pus that is walled up and sometimes develop a thin wall within it. Okay, that means what? After invasion of the Staphylococcal aureus will first cause localized skin infection or pimple. Then this pimple will evolve into furuncle or boil, and those furuncle or boil then cluster together to form carbuncle. Okay, and then there will also be some diffuse skin infection like superficial impetigo, that is the infection of the epidermis, and some deeper reaching cellulitis, which is an infection of the dermis, and that can spread through larger surfaces rapidly. Okay, and now from that part, when the infection reaches deeper, it can develop subcutaneous abscess, okay, which is the collection of the pus that is walled up or develop a thin wall within it, a process called septation. Okay, so now along with that, if Staphylococcal aureus is overlying a muscle, it can cause muscle infections such as pyomyositis. Okay, that I have written here. Okay, that means if the Staphylococcal aureus is overlying a muscle, it can cause muscle infection, and if it is in bone, it will facilitate osteomyelitis, and if it is in joint space, it can cause septic arthritis. Okay, along with that, this subcutaneous abscess can be occur in mouth also, okay, that causes dental abscess. Along with it can also occur in liver, in kidney, in brain, in spleen. Okay, so we have start with that part, that Staphylococcal aureus will invade, okay, when there is a larger break present in the skin, right? Now after invasion, they will cause some localized skin infection known as pimple, and then this pimple will evolve to form furuncle or boil, okay, and this furuncle then cluster together to form carbuncle. Okay, and there can also be some diffuse skin infection like superficial impetigo, which is an infection of the epidermis, and also some deeper reaching cellulitis, which is an infection of the dermis. Okay, sorry, and can spread over larger surfaces rapidly. And when this infection or those Staphylococcal aureus enter deeper, it can develop into subcutaneous abscess, that is nothing but a collection of pus that is walled up or sometimes develop thin wall within it. This subcutaneous abscess can spread to muscle, spread to mouth, causing dental abscess. Along with it can also spread to liver, kidney, brain, and spleen. Okay, and this Staphylococcal aureus can also overlying the muscle, causing muscle infection called pyomyositis. It can also spread to bone, causing osteomyelitis, and it can also spread to joint space, causing septic arthritis. Okay, so that is the idea in the first page. So we have learned So we have learnt in this page that is Staphylococcal aureus is extremely common and it is the normal flora of the skin. But in 1/4 of the population it colonizes, right? And it mainly colonizes in nostrils, armpits and groins. Okay, and although they are normal flora of the skin and live without causing any problem in skin, but when the environment supports their overgrowth, for example when there is appropriate humidity, appropriate pH and appropriate sweat level, and also there are appropriate bacteria present that will support the colonization of the staphylococcal aureus, there will be a staphylococcal aureal colonization in the skin ecosystem. Okay, under such circumstances, if staphylococcal aureus found under such circumstances, if staphylococcal aureus find smaller gap or tiny microfissures, it can start to penetrate through those tiny microfissures. Okay, and in some cases they can also get larger breaks, and from those larger breaks large amount of the staphylococcal aureus can enter. Okay, and that can facilitate different type of infection. Okay, so after the invasion of the staphylococcal aureus, they will first cause some localized skin infection or pimple. Okay, this pimple will evolve into furuncle or boil, and bunch of furuncle then cluster together to form carbuncle. Okay, so there can also be some diffuse skin infection known as superficial impetigo, that is infection of the epidermis, or deeper reaching cellulitis, which is infection of the dermis and can spread over larger surface rapidly. Okay, and from that part then when the infection goes deeper, it can develop into subcutaneous abscess. Okay, which is a collection of pus that is walled up or sometimes develop thin wall within it. Okay, a process called sepsation. So now from that subcutaneous abscess, the subcutaneous abscess can move into mouth causing dental abscess, and can into liver, in kidney, in brain and in spleen. Okay, and now those staphylococcal aureus can also overlying muscle causing pyomyositis. Okay, and also can go into bone causing osteomyelitis, and also can go into joint space causing septic arthritis. So now let's move to the next part, that after that staphylococcal aureus can get into the bloodstream causing septic thrombophlebitis, which is an infected blood clot. Okay, so as it now have entered into the bloodstream, so I have told you previous time that bacteria in the bloodstream is called bacteremia. Okay, so this is the onset of bacteremia, okay, which can cause serious types of problem. Due to the presence of this bacteria, there can be a widespread immune response which causes the blood vessel to expand. Okay, and as a result blood pressure will fall. Okay, so what is going on, that staphylococcal aureus will gets into the bloodstream. Okay, and in the bloodstream it causes septic thrombophlebitis and infected blood clot. Okay, and inside the bloodstream, due to the presence of staphylococcal aureus, bacteria condition is established. Under such circumstances, there will be widespread immune reaction that causes the blood vessel to expand, and as a result blood pressure will fall, which facilitate hypotension, perfusion to various organs, a process called sepsis. So now from the blood it can transfer to various important organs, like it can transfer to cerebrospinal fluid causing central nervous system causing bacterial meningitis or epidural abscess. It can also transfer to lung causing severe pneumonia. It can also transfer to heart valve. Okay, and inside the heart valve it starts to grow in the valve in clumps causing septation, okay, so in the heart valve what it goes, so in the heart valve it will starts growing, and in especially clumps, and causes vegetation. Okay, and it also starts damaging the valve, a process called infective endocarditis. Okay, and after that infective endocarditis, bits of the vegetation can then chip off and embolize further to causing other local infection. So that is the thing going on inside the bloodstream. You know that Staphylococcal aureus, after entering the bloodstream, it will cause septic thrombophlebitis and infected blood clot. After that, as bacteria is now in the bloodstream, it will establish the bacteremia condition, which causes severe problem. Okay, because it stimulate a widespread immune reaction. This widespread immune reaction causes blood vessel to expand and the blood pressure to fall. And also hypotension and perfusion, which is a of various organ, which is a process called sepsis, and from that blood it can also transfer to central nervous system, causing bacterial meningitis or epidural abscess, and it can also transfer to lung, causing severe pneumonia, and it can also transfer to heart valve that starts to grow inside the heart valve. It starts to grow in the clump, causing vegetation. Okay, and it facilitates the damaging of the valve, and as a result bits of the vegetation then chip off and embolize further, and this entire condition facilitates a complication called infective endocarditis. So we have up to that part discussed about only one pathway, that is Staphylococcal aureus entering through the skin, and then after causing severe infection it can transfer to blood. Okay, there are another pathway where Staphylococcal aureus can enter directly into the bloodstream. Okay, for example, let's say when a person is getting surgery or having a dental work done. So this event although occur infrequently, but we have to take necessary precaution against it, especially person who are immunocompromised or who have serious risk for infective endocarditis are at high risk, and they should be given antibiotic prophylaxis. Okay, so up to that part we have, if we try to plant. So first thing that we have to discuss that Staphylococcal aureus is extremely common. Okay, and it is the normal flora of the skin. Okay, and about 1/4 of the population colonizes Staphylococcal aureus, especially in the nostrils, armpits and groin. So now under such circumstances they are normal flora, I have told you, in the skin. They are not causing any kind of problem, but when the environment favors, the pH, the humidity, the sweat level and other bacteria favors their colonization, they will increase their number. Okay, and once there are too much amount of bacteria present, they will start to enter through the tiny microfissures in the skin. Okay, and they can also try to enter through the larger breaks. Remember here one important thing, that larger break facilitates infection, and the smaller amount of Staphylococcal aureus with intact skin facilitates colonization. Okay, so now after that Staphylococcal aureus will invade the skin, and inside the skin it will first cause a localized skin infection known as pimple. This pimple will then evolve to form furuncle or boil, and then those boil bunch of furuncle then will cluster together to form carbuncle. Okay, and there can also be some diffuse skin infection like superficial impetigo, which is an infection of the epidermis, or deeper reaching cellulitis, which is an infection of the dermis. Okay, and can spread over larger surfaces rapidly. Okay, so now after that, if the infection goes deeper, it can develop to subcutaneous abscess, which is a pus, collection of pus that is walled up or sometimes develop thin wall within it, a process called septation. Now this subcutaneous abscess can also causes in mouth, causing dental abscess, in liver, in kidney, in brain and spleen. Now if the Staphylococcal aureus is overlying in the muscle, it can cause pyomyositis. If it is in bone, it can facilitate osteomyelitis, and if it is in joint space, it can cause septic arthritis. So that's it, right? So after that, causing those kind of things, Staphylococcal aureus then gets into the bloodstream, where it can cause septic thrombophlebitis or infected blood clot. Okay, So in addition, bacteria is present in the bloodstream, so it already established the bacteremia situation, which can cause severe problems. Okay, so under such circumstances, it can facilitate typically a widespread immune reaction. Okay, and that can cause blood vessel to expand and a blood pressure to fall. And as a result, as blood pressure is fall, it can facilitate hypotension and perfusion, which is a process called septation. And as now bacteria in bloodstream, so it is obvious it can transfer to various important organ, for example our central nervous system, causing bacterial meningitis or epidural abscess. It can transfer to lung, causing severe pneumonia, and it can transfer also to heart valve, where they grow in clump, causing vegetation. Okay, and this vegetation causes damaging of the valve, causing a situation called infective endocarditis, and bits of the vegetation then chip off and embolize further, causing other local infections. So that is the one pathway. And then we have learned that Staphylococcal aureus can also directly enter the bloodstream, okay, via a process when a person are getting surgery or having a dental work done. Okay, although those events are rare, but as they are coming, we have to take important precaution. Okay, mainly person who are immunocompromised or who are having serious risk in infective endocarditis should be given antibiotic prophylaxis. Okay, so that's it for today, friends. So today we have discussed what kind of infection Staphylococcal aureus caused. We have discussed from pimple or localized skin infection, then we have discussed about boil or furuncle, then we have discussed about the carbuncle, then we have discussed about the superficial impetigo, then we have discussed about the cellulitis, then we have discussed about the subcutaneous abscess, then we have discussed about the pyomyositis, then we have discussed about the septic arthritis and osteomyelitis, and in the bloodstream we have discussed about septic thrombophlebitis, and then we have discussed about the bacterial meningitis or epidural abscess, and then in lung we have watched the cause of the disease pneumonia, and in the heart valve we have seen the infective endocarditis. Okay, so that is for today's class. So in next video we will going to discuss about the biofilm formation of the Staphylococcus aureus. Okay, so till then, friends, bye bye.